This gives us about 3.5 weeks in phase 2 where we have been able to follow the data. It continues to continue to be surges in other states, and we are monitoring that very closely. We outlined what phase 3 will look like last week. It still means you're safer at home, especially if you're vulnerable. It means we're still strongly encouraging teleworking. People still need to focus on physical distancing in all situations outside of their home. Face coverings are still the right thing to do in indoor public spaces. But phase 3 will also bring some changes. Social gatherings may include up to 250 people. The cap on capacity for non-essential retail will be lifted. So will the cap on capacity for restaurants and beverage services, but physical distancing is still required. Entertainment venues like museums, zoos, and other outdoor venues may open at 50% capacity with a cap of 1,000 people. Gyms and fitness centers may be open up to 75% of capacity. Personal grooming services such as hair salons will still need to follow physical distancing requirements. Child care facilities may be open. Overnight summer camps will still be closed. Recreational sports will still require physical distancing, and swimming pools may be open at 75% of capacity with physical distancing. I want to reiterate that everyone should continue to take this pandemic very seriously. Cases are on the rise in many other states, as I said previously. I do not want to see that happen in our Commonwealth. Be cautious and take the necessary steps to protect yourself and the people around you. That means face coverings, which are increasingly supported by the science. It means physical distancing and frequent hand washing. We all have a responsibility to continue the social distancing, the hand washing, not gathering in large groups. And if we can continue to do that, I think our numbers will continue to trend favorably. The question was, will we go back to phase 2 or phase 1 if we need to? Obviously, if we see surges in the Commonwealth and we're going in the wrong direction, then obviously we're going to have to make difficult decisions to do that. But one of the reasons that we are where we are today, and I would never have made this decision that I did, is if I weren't confident in our hospital capacity. They've done a wonderful job. As you remember, they stopped doing elective surgeries to really increase their PPE, their staffing, their ventilators, et cetera. So that has a lot to do with this. Also, the fact that we now have the testing capabilities, and we're in the ballpark every day of 10,000. I really anticipate that will increase, especially as we allow students to come back onto campuses. There's going to be more testing, more prevalence testing out there. So that has ramped up every day to a point where I'm comfortable that we can look at different areas of Virginia by health district if we need to do more testing, if we see the numbers going up, that we have that ability. And then finally, the tracing we've been talking about every day is that we now have around 1,000 tracers. We will have more as we move forward. And so all of those things together allow us to be where we are today and to really try to open up our economy, get people back to work, and get back to that near normal. But I think the reality, and we need to remind ourselves, is that this virus is still out there. It is still very contagious, and as I said earlier, we need to take this very seriously. And if we become complacent and don't continue to follow these guidelines, then the possibilities are there that we would have to go back, and I don't want to do that. I don't think anybody wants to do that.